that health obviously is one of the main concerns around social responsibility and on governance on health is a topic which deserves more attention than probably it has had in the past. So we have here Madame Petra Lowe, and Petra, I think you're head of public affairs for Novartis. And Steve, maybe you can introduce yourself so that you can maybe tell us about your foundation.
Yeah.
And yes, why not?
Oh, okay.
I think it will be helpful to the discussion.
I think nearly everybody knows what I do, actually. Well, my friends are in the room, but just briefly to say, I'm here, I'm not a health expert. In fact, I'm completely inexpert, as those who know me would know. But I'm very interested in the process of global governance, and that's what my foundation, which is based in Australia but operates globally, is involved with, is how do we push from outside government to assist government to achieve better global governance. And I think it's really interesting when one considers the topic of health, which we will talk about today, plugging into global governance or a lack of global governance. I think it's a really interesting issue, and I will talk from a position of the process of governance rather than the technique of health and health industry. Thanks.
So maybe I could give some introducing remarks which are coming from an industry representative, but also from somebody who has not been involved in this industry for so long, so that I can pretend to be somewhat still naive around the health issues. And I like just to make these comments around two, I mean, sort of view of the status of the development of health over the world in the last 10 to 15 years. And from what I see, and I think that as an industry player, what we see is that on one hand, there had been a significant improvement of the health status of the world in vast areas, and this has been largely linked to the improvement of the wealth, the general wealth, and the ability for developing countries, which now we all know are more than developing countries, and start to be ahead by many means of the developed world, having been able to offer to their population health status which they could not afford some 10 or 15 years ago. I mean, I could just take an example I experienced just 1 year ago at the time of the H1N1 crisis. And it was really striking to see that at the same time that we had in many European countries, including France, a large debate around H1N1 vaccination, and that basically only 5 million French inhabitants were vaccinated. At the same time, President Lula was acquiring 60 million doses of H1N1 and vaccinated exactly the same number of Brazilians over 3 weeks, when, if I remember what happened in a country like France, it took something like 3 months to just vaccinate 5 million people. So we start to see that other countries, but to developed countries, tend to take seriously health matters and put in place the relevant systems and health systems to take care of the health of population in a way which can definitely, on a comparative basis, can eventually beat what can be done in other areas. And more generally, I think we could say that whether we speak about Brazil or India and China, there is a clear understanding from governments that there is, I would say, a view that health is an investment and that it's worth investing in health for the sake of the wealth of the population, but also because indirectly it helps the global development of their relevant countries. The second thing, which I think, and we discussed that this morning between ourselves, has been rising over the last 15 years, is that beyond the role of international bodies like WHO, some the private foundations have started to play a significant role in helping to develop prevention in particular, and we all can think about the Bill Gates foundations as well as Gavi. We can also say that we've seen an increased use of vaccines on prevention for infectious disease. And I mean, we can say as an example that we, Sanofi, we vaccinate or we give shots, more than 1 billion shots every year of vaccination all over the year. And we are just one, yes, significant, but only one of the players of the vaccines activity. Moreover, I think there's been progressively a recognition that the industry, and this is where I speak as an industrial actor, has a role to play. I mean, over the 90s, there was a debate about the role of the industry to provide affordable medicines. I think that the industry on one hand, on the opinion on the other hand, have moved in the right direction to help providing affordable medicines to a larger number of people. However, on the other hand, we must recognize that we are far from being where we would like to be. Well, we all know the statistics. I mean, the billion of inhabitants, we don't have access to basic sanitations. The fact that infectious diseases are still well spread, and there are some people here who obviously know that better than I do, in particular in South countries, that infant mortality is much higher in Africa than in Europe, for example, and that we see at the same time the development of chronic diseases which are largely undiagnosed and which are spread all over the world. I mean, we can speak as an example of diabetes, where we know that if I take China, for instance, the estimate is that there are 70 million diabetes patients, out of which only around 10 to 12 million are diagnosed and treated today. So it's clear that there is still a huge gap between what could be a reasonable and acceptable level of health for the worldwide population and where we are today. And last but not least, I think we should mention that there are still a large number of unmet medical needs all over the world, whether they involve elderly people. We can think about CNS, autoimmune diseases, and also, I mean, respiratory diseases, which appear to be more prevalent because of the development of the living in big cities on pollution, air pollution in particular. So it looks like, I mean, when there have been progresses linked largely to some changes in the way countries tackle diseases, and here I'd like to start to open the discussion. I'll pass the word to my two neighbors. I think that there is still a need to, there is still a lack of global governance, and this I think should cope still with 4 areas. The first is prevention, and here I think there is some role and there is some progress being doing. The second is education, and education goes with people, but definitely with the development of health systems. And this is an area where the industry can only be one of the players, and where governments clearly has to play a larger role. Cooperation, when and if possible, and access to medicines in one of the areas. I mean, taking care of neglected diseases, as we do, for instance, in Sanofi, is an area where we can continue to improve. But last but not least, innovation. And here I would say that as an industry player, I am wondering, looking forward, who is going to finance research on innovation in the future. And if the way research and innovation in medicine is financed today, largely to the developed countries, is sustainable in the long term, when on the other hand, it doesn't look like there's been significant improvements in the way the developing countries or other countries start to contribute, both in terms of remuneration scheme, but also in terms of protection of intellectual property. So with this introducing remarks, I suggest that maybe I can leave the floor to, I mean, would you like to take it, Petra?
I continue, yeah.
Okay.